Health Department of SCPM College of Nursing and Paramedical Sciences take this opportunity to welcome you all in this online school health education on National Deworming Day 2022, organized by Child Health Nursing Department of SCPM College of Nursing and Paramedical Sciences, Gonda. So, first of all, I would like to welcome our honorable chief guests, Dr. O.N. Pandey sir, Chairman, SCPM Group, Mrs. Alka Pandey ma'am, President, SCPM Group, Dr. Ayush Pandey sir, Managing Director, SCPM Group, and Dr. Ayushi Pandey ma'am, Secretary of SCPM Group. I welcome you all from the bottom of my heart. Next, I would like to welcome our special guests, Mr. Ajitab Dubey sir, Director, SCPM Group, and Mr. Dheeraj Kumar Dubey sir, Administrator of SCPM Group, Gonda. I welcome you both, sir, in this online program. Next, I would like to welcome our Principal, ma'am, Professor Mani Megla, ma'am, and Vice Principal, Professor Smita Pulit, ma'am. They both are working towards connecting young mind to the strive towards the success and achievement. So I welcome you both, ma'am, in this program. Now I would like to welcome Principal Ram Giri sir of St.Xavier School, Gonda, and Principal Reena Mishra ma'am of AIMS International School, Gonda, to accept our invitation and join our program. In the sequence of welcoming, I would like to welcome our today's speaker, Professor Muthu Maheshwari ma'am, HOD of Child Health Nursing Department, SCPM College. Today, she will be going to hold the session on deworming and many other topics on it. Last but not least, I would like to welcome all the respected HODs, teachers of SCPM College, St. Xavier School, and AIMS International School. I welcome all the teachers, those who are present here. Next and last, I would like to welcome all the loving students, participants of SCPM College, St. Xavier School, and AIMS International School. I welcome you all in this online school health education program. I hope you all will learn something important and you'll follow it. So I welcome you all once again. Thank you so much. Over to you, Sudhir.
Thank you, Mr. Shankrapundan sir, for your welcome speech. Now, we will discuss about the significance of this day, National Deworming Day. So, before starting our discussion, I would like to show one video which gives you an idea about the importance of this day.
जा सकती है।
आज्ञा राजू बेटा, हम सब 10 फरवरी सुबह रेलगाड़ी से तुम्हारी मौसी के घर जाएंगे।
पर उस दिन तो
में नियंत्रण की दवाई खिलाई जाएगी। कृमि बच्चों के शरीर के लिए महत्वपूर्ण पोषक तत्वों को खा लेते हैं, जिससे बच्चे के शरीर में खून की कमी, कुपोषण और वृद्धि में रुकावट आती है। 1 से 5 वर्ष के बच्चों को यह दवाई आंगनवाड़ी केंद्रों में खिलवाई जा सकती है। कृमि से छुटकारा,
सेहतमंद भविष्य हमारा।
So now I will discuss why this day is so important. National Deworming Day. National Deworming Day is celebrated all over India on every 10th February since 2015. National Deworming Day is a day dedicated to deworm all the school-going children, preschool children, and all the children whose age group is 1 to 19 of the country to give them a healthy digestive system. It is a government mission. This is a government mission which aimed to reduce the cases of worm infection among kids all over India. History of National Deworming Day. As per the reports of World Health Organization, near about 220 million of children were at the risk of worm infestation. So in order to combat this crisis situation, Government of India under the Ministry of Health and Family Welfare launched the National Deworming Day in February 2015 as a part of National Health Mission. The main aim of this mission to deworm all the children whose age group is between 1 to 19 years of age, and by deworming them, give them a proper health and well-being. Not only Ministry of Health and Family Welfare, the Ministry of other stakeholders like Ministry of Rural Development, Ministry of Urban Development, Ministry of Panchayat Raj, Ministry of Water and Basic Sanitation, Ministry of Women and Child Development, all these ministries are also extended their support to make this program a huge success. In order to implement this program at all levels, school teachers, Anganwadi workers, ASHA workers also have been trained, uh, and information have been given to them to spread awareness regarding this campaign. It is one of the largest public health campaign in the world. When it started in 2015, This program was launched in 11 states and union territories with the target of benefiting 10.3 crore of children in the age group of 1 to 19 years of age. But we couldn't achieve the target as we achieved near about 9 crores of children have received deworming tablets. So in 2016, year by year, we have increased our coverage of deworming children. In 2016, we have targeted 27 crores of children, and in 2017, we have targeted around 34 crores of children. Under this program, we aimed to deworm all of them, and we also achieved a huge success in this campaign with the coordinated efforts of all the ministries um, and the implementation and with the support of all the school teachers, all the workers and Anganwadi workers. Along with deworming means, actually deworming means we are providing albendazole tablet, which is effective against all kind of worm infestation. So along with deworming the children, some other activities are also performed in order to boost this campaign. The practices were to promote cleanliness and hygiene among the children, and hand washing techniques, promotion of basic sanitation, and education to the children regarding wearing shoes and slipper while playing in the soil. So all these areas we have given education. We have given education to the children, because by concentrating these areas also we can reduce the incidence of worm infestation. Apart from giving tablets, we have also concentrated on these practices. Why National Deworming Day is so important? National Deworming Day is very much important in our country, because it plays an important role to reduce the case of worm infection among the kids by giving tablet and spreading awareness. Actually, the children are very much vulnerable to the worm infection in their childhood, and it will affect their physical and mental health. If they are getting infected with the worm infection, definitely their physical and mental health will be affected. So, by celebrating this day, we are providing them tablets to prevent the infection and for the treatment. And also, by celebrating this campaign, we are spreading awareness regarding the practices which can prevent worm infestation, and regarding the importance of taking albendazole medications. Why it is so important? Because if the children is infected with worm infestation, this worm actually it is a parasite. It will interfere the nutrient uptake. So the children won't get their protein uptake, their absorption of protein, absorption of iron, everything will be affected. So the children can be suffer from anemic and malnutrition, and they will become weak, sick. Their sleep disturbances and other disturbances will lead to create mental problems among the children. So all these health effects, health problems will be occur. So we all know when if the children become anemic, they cannot concentrate on their academic activities also. Not only academic activities, their physical, mental health, everything will be affected. So we started to celebrate this day, and on this day we used to provide albendazole tablet. It is a chewable tablet. We can distribute this tablet to all the government aided and private schools, including Anganwadis, in order to prevent worm infection among children. This day is so important because by providing all these measures, we can make our children healthy. Children are the future of the nation. They must be healthy and happy in all the sense. What is the speciality on this day? On this day, all over the country, we are providing tablets, deworming tablets, albendazole, to all the children whose age group is 1 to 19 years of age. The children whose age group is 1 to 9 can receive their tablet from the Anganwadis, and other children can receive their tablets from the schools. And if and these tablets are free of cost. And if any children couldn't take on the particular time, then there is a mop-up day on 15th February. अगर 10 February में नहीं ले पाएंगे, so there is a mop-up day on 15th February. So that day they can receive tablets from the schools and Anganwadis. Even if the children is not registered with the schools, they also can take deworming tablet from the Anganwadi. So by providing these deworming tablets, all the children will get benefit under this campaign. So as we discussed the goals of this campaign, actually before discussing the goals of this campaign, you should know if the children is infected with parasites, as I discussed, they will face a lot of health problems physically and mentally. And most probably the school going age children, they can get infected from the STH, soil transmitted helminths. तो ये helminths से infect होने का ज्यादा chances होता है. It is very common. So according to the WHO, as I discussed earlier, around 220 million children are at the risk of worm infestation. So our main goal of this campaign is to provide deworming tablets and to stop the occurrence of this worm infestation, or to reduce the incidence of worm infestation, so that we can make our child healthy and they can be free from many type of nutritional disorders and anemia. So by giving deworming tablets, not only health aspects, they can concentrate on their academic activities also. So the main goal of this campaign is to deworm the child at any cost and help them to improve their health education, improve their education and productivity. How National Deworming Day is celebrated? You see, actually, as per the report, our states have been divided on the basis of prevalence rate. हमारा स्टेट पूरा स्टेट जो है ये प्रिवालेंस रेट का बेसिस में डिवाइड किया हुआ है. Prevalence rate means the probability of having disease. The probability of having disease, that is known as prevalence. So based on the prevalence rate, our states and union territories have been divided. States including Uttar Pradesh, Tamil Nadu, Arunachal Pradesh, and Jammu Kashmir, Chhattisgarh, all the Assam, Mizoram, Uttarakhand, all these states having more chance, all the children in these states having more chance to get infected because prevalence rate is very high here. So the distribution will be 2 times in a year in these states. That means February 10 and August 10. These are the dates for the distribution of deworming tablet. So we can say biannual distribution. Biannual distribution means there will be 2 times distribution. Deworming tablets will be distributed 2 times in a year, which is on February 10 and August 10. Why we are distributing 2 times? Because these states are having higher prevalence rate. That's what we are distributing 2 times. And also the states like Kerala, Karnataka, Himachal Pradesh are also having moderate prevalence rate. So here also we should distribute these kind of tablets, albendazole, 2 times in a year. Only 2 states, that is Rajasthan and Madhya Pradesh, is having low prevalence rate. That means the children in these states are having less chance to get infected. Studies are showing this statistics. So, Madhya Pradesh and Rajasthan, we will do distribution only one time, that is on February 10th. So, by this way, we used to celebrate National Deworming Day, annually distribution and biannual distribution. Except to two states, Madhya Pradesh and Rajasthan, all the states and union territories will receive 2 times distribution of deworming tablets for the effective prevention of worm infestation. And all the staffs, including teachers, Anganwadi workers, ASHA worker, and other officials, should get involved in this distribution of tablets. Not only distribution of tablets, all the educational program which promote this campaign, they should involve and they should promote so that all the children can receive the benefits. And for your information, जिनका मोबाइल में गूगल प्ले स्टोर है, वो नेशनल डीवॉर्मिंग डे का आप डाउनलोड कर सकता है. नेशनल डीवॉर्मिंग डे आप is available in the Google Play Store, and all the activities which is running in our country is shown in that app. हमारा कंट्री में जो रिपोर्ट्स होता है, जितना केसेस रिपोर्ट्स होता है, the beneficiaries, number of beneficiaries, number of reports, all the activities under this will be shown in that website. Google Play Store में जाके आप नेशनल डीवॉर्मिंग डे आप डाउनलोड कर सकता है, उसमें ये सारा डिटेल्स आपको मिल जाएगा. So this is the significance, importance of why we are celebrating this day. Now, I would like to invite Professor Mrs. Muthu Maheshwari Madam, HOD, Childhood Nursing Department, to discuss about the causes of worm infection and the transmission of treatment and prevention of worm infection. And Madam also will discuss about the treatment regimen and home remedies to prevent worm infection.
Good afternoon, everyone. As I told about the significance of today's day, I'm going to tell you about some basic information regarding worm infestation. So, as I told that worm infestation is common among children and it is commonly affecting the age group between 1 to 9. Our government of India has started this program to Okay. So according to the World Health Organization, people in the developing world are infected with intestinal worms. Mostly it is affecting the developing countries' children due to the improper sanitation and they are eating the contaminated food and water. Due to that, they are more prevalent to having this type of infection. It's not moving this slide. Maybe. So before going to detail about this, we have to know certain terminologies which is helping you to understand about the worm infestation. So what is worms? Worms are the parasite that lives inside the host intestine, and it will suck the blood and other nutrients and they produce certain type of symptoms and diseases. Okay, they are called as worms. Then parasite. What is parasite? Parasite is an organism that lives in or on the host and get its food from the host. So parasite can also cause disease in humans. That's why worms are called as parasite. So what is infestation? So infestation is the presence of unusually large number of insects or animals in a place. So that's why when worm is residing inside the human body, it is called as infestation because of multiplication of various number of worms inside our body. It is called as infestation. Okay, so when you are understanding these terms, we are able to understand what is worm infestation. Next, we will discuss about the incidence which is or prevalence which is commonly occurring in our India. According to the World Health Organization, around 24% of world population is infected with soil transmitted helminths. So there are one type of infection which is commonly occurring from the soil. That's why it is called a soil transmitted helminths. So the soil transmitted helminths is responsible for 24% of infection in the children. 241 million children between the age group of 1 and 14 years are at risk of parasite intestinal worms in India. Almost 7 in 10 children between 6 to 15 months of age are anemic because of this worm infestation. This higher rates will be seen over the rural area children because of their unhygienic practices. So this is the incidence of worm infestations in India and around the world. So already I told there is a type of infection that is called as soil transmitted helminths. So what soil transmitted helminths means? It is a type of worms which is present in the soil, which is contaminating the soil, and it can be transmitted to the host, or it can be transmitted to the intestine of the host by ingestion or eating any contaminated food. The three types of soil transmitted helminths are commonly causing infection over the children. The first type is roundworm. This roundworm is otherwise called as Ascaris lumbricoides. Other type is whipworm. This is also a type of soil transmitted helminths which is producing infection over the child. Third type is hookworm. These three type of worms are commonly infecting the children, and it is commonly presenting in the soil. That's why it is called as soil contaminated helminths or soil transmitted helminths. So how this soil transmitted helminths are transmitting into the host, or host means there are different ways it can be transmitted to the host. Okay. So in the host, how it is commonly transmitting is the eggs are the main thing which will be entering into the intestine of the infected people. So when this intestine of the infected people, there may be a hosting of adult worm. This adult worm is laying many number of eggs in the intestine of the host. So when the person is defecating, it will be transmitted to the soil. So the soil will be full of contaminated with the infected worm eggs. So when this infected worm eggs are enter into the body through many ways, mainly it is attaching with the vegetables and fruits what we are ingesting. Vegetables and the fruits without proper washing when the person is eating, it can be entered into the person intestine and produce again it is multiplying and producing a worm infestation. Another mode of transmission is when the ingested through contaminated water. Okay, water is the common cause where there is the when the soil is contaminating the water source. In the water, that water source will be taken by the general public means it may be entering into the intestine and it is producing legs and it may producing a worm infestation. And third way of contamination or third way of getting the infection is when the children are playing in the contaminated soil. So where after playing, if they are not washing their hands and feet properly, this may be entering into the intestine. Okay, so this is the common three ways where the eggs are entering into the host and it will be laying eggs and multiplying into various number and it is producing various symptoms. Another mode of this transmission is when the person or when the contaminated soil is there, when the person is walking or playing in without any wearing shoes or when they are walking in a barefoot, some worms are having the capacity to penetrate the skin. So when the skin is getting penetrated, easily it is entering into the blood supply and it is reaching its target place and it is multiplying and producing a worm infestations in children. Okay. Then other thing is there is no direct person-to-person contact. It is not transmitting from one person to another person directly, but it may be transmitted through the soil, the infected soil only. So these are all the modes of transmission. So as a conclusion, I am telling how it is this soil transmitting elements are transmitted and it is producing infection. Okay. So when the person is ingesting a contaminated food or contaminated soil, so contaminated water, it will be entering into the human intestine and the worms will be producing thousands of eggs on each day. Each day it is producing thousands and thousands of eggs. So when the eggs are passed in the feces of the infected person, mainly some rural areas they are practicing open field defecation pattern. So because of that, this worms may be entering into the soil and the worms are highly infected. So when the contaminated soils are spreading the infection through ingestion of raw vegetables or contaminated water, it may be going to the host intestine and it is multiplying and it is producing a certain type of or various type of symptoms in a person. Okay, so this is the some information regarding how it is transmitted. So next is the how the infection is causing or how the infection what is the main cause of this worm infestation in children. So already I told that how it is transmitting. So that is the various mode the infection will be transmitted to our children. First one is when the child is consuming infected food or water. Then improper hygiene. Improper hygiene is an important aspect and it is an important cause for worm infestation in children. When the child is not washing their hands properly before food or after going to a toilet, if they are not washing their hands, means it may be mainly causing the worm infestation over the children. So next one is signs and symptoms. When the child is getting infected with the worms, what may be the symptoms will be shown by the child. So because the child, when the worms are entering into the intestine, it is affecting various process of metabolism, various process of digestion. So it may be commonly showing the symptoms related to GA system. The child may be having severe pain over the stomach and the child may be having severe vomiting due to irritation or the toxins which is produced by the worms will be producing or triggering the vomiting center. The child will be getting vomiting and it is reducing the appetite of the child because of fullness, which there is a egg and lot of number of organs, lot of number of worms will be present in the stomach of the child. It may be feeling fullness. So it leads to lack of appetite and it produces certain gas, which leads to blotting of the abdomen. Another signs and symptom is the child may be having anemia and weakness. Anemia and weakness is due to there are worms which is sucking the blood from the host. When it is staying in the intestine through the minute blood vessels, it is sucking all the blood. So due to that, the child will be having low HP level. Due to that, there may be a anemia, and anemia, the main symptom is weakness. The child is always lethargy, not playing actively. The child will be sitting in a place for a long time due to weakness. So that is another symptoms. Next symptoms, other symptoms may be perianal itching. So perianal itching is due to when the worms are there in the intestine, it is laying a huge number of eggs. So when the eggs are transmitting all over the perianal area, the child will, it will be hatching like a small worms. So when the worms are staying over the anal area, the child will be always having a itching over the perianal area, and the child may be having abdominal distension and constipation. So abdominal distension and constipation is due to the presence of huge number of worms will be blocking the intestinal movement. So due to that, there may be a abdominal distension and constipation will be occurring for a child. So other symptoms is worms in the stool. When the child is passing a stool, there is huge number of worms may be present. And if it is a severe cases or severe form of worm infestation, the child may be coughing up the worms when they are sneezing or when they are vomiting. There may be a huge number of worms is coming through nose and mouth. Then the child may be having a unexplained coughing, wheezing, or shortness of breath. Unexplained coughing, wheezing, and shortness of breath is due to allergic towards the worms. The worms may be producing certain allergy over the respiratory system, so it may be causing coughing, wheezing, and shortness of breath in a non-asthmatic children. So that's all about the signs and symptoms which is shown by the child during worm infestation. Next one is preventive chemotherapy. When the child is having a worm infestation, our government of India has prescribed a preventive chemotherapy using annual or biannual single dose of albendazole 400 mg or mebendazole 500 mg. For all the children, it is recommended. So biannual administration is recommended where the baseline prevalence is more than 50%. As I told, there are some areas where there is a high prevalence of worm infestation. In that area, biannually these tablets are administered. So when the child is having the age less than 24 months, we need to administer a half dose of albendazole, that is 200 mg. Commonly for all older children, 400 mg is prescribed. In children younger than 2 years, 200 milligrams is prescribed by the government of India. So this is the how we need to administer the albendazole tablet. In the deworming day, all the schools will be providing a tablets to the children. So according to the age group, dosage may be differ. So 1 to 2 years, we need to administer a half tablet. 2 to 19 years, full tablet should be administered. So appropriate administration of tablet is an important part of this deworming day. During intake, we have to observe that whether the children are chewing the tablet properly. If they need water, means we need to provide some amount of water. That when we are providing water, that should be a clean drinking water, because through the water, germs can be transmitting. So the water, we have to assure that we are providing a clean drinking water to our children. If the children is not able to chew a tablet or swallow a tablet, it should be crushed. It should be crushed as a powder and it should be administered to our children. Okay? So this is the dosage which is given during a deworming day. Albendazole tablet is given. So when we are administering the tablet, we should follow certain guidelines or certain procedure. When we are administering the tablet, we need to check the general condition of a child. So when the general condition is poor, when the child is not feeling well, or when the child is having any type of sickness, we should not administer deworming tablet. We need to wait until the child is recovering from a illness. So when the child is recovering from the illness, we have to consult with the medical doctor whether we can provide a deworming tablet or not. So when we are administering tablet in the school or in the Anganwadi, we have to check for the children whether they are developing any allergic reaction or adverse events towards the this tablet. Allergic reaction towards this tablet is very minimal, but when the allergic reaction occurs, we need to immediately help the child to go to the nearest medical department. So always in the school and Anganwadi, there should be all the contact numbers should be available of the nearest medical officer of PHC or any Anganwadi worker numbers or any ANM numbers should be available. 24 hours should be available in the school for emergency helpline. So this is the precautions we need to follow when we are administering drug in the school. We have to check whether the child is sick, or if the child is developing any adverse event, it should be immediately notified to the nearest medical health. So Next one is how we can prevent this worm infestation. As Sir told many of the preventive measures, one of the preventive measures is what is the mode of transmission. According to that, we need to take measures to prevent the transmission of the worm infestation. So the first and foremost measure of worm infestation prevention is when we are allowing the child to play or going out of our house, we should ask the child to wear chappals or shoes while playing or walking. They should compulsorily wear the shoes and chappal when they are, especially when they are playing in the soil, because there are certain worms will be penetrating the skin and entering into the body. So that's why we should ask the child to wear chappal and shoes when they are playing outdoors. Then we need to keep nails short and clean for the children. When they are having longer nails, there is more chance of infection transmitting in the children. Then we need to advise the child to wash their hands before eating and after using the toilet. Another measures for prevention of worm infestation is we have to assure that whether the child is consuming a safe, clean and drinking water. This is an essential part. Through the water also where the worms can be transmitted. Next one, when we are using vegetables and fruits, it should be properly cleaned, especially when we are consuming a uncooked fruits, uncooked vegetables, it should be properly cleaned properly and we have to peel off the skin whenever necessary. The last measure is use clean toilet and keep the surroundings clean and green. So these are all the various measures through we can prevent the worm infestation prevalence. So when the worm infestation occurs, how it will affect the child's health. So first complication which occurs because of worm infestation is anemia. So as I told earlier, anemia is caused by sucking of blood by the worms. So it's reduced the blood volume of the child may be going for anemia. Then another one is malnutrition. All the worms for their survival, it is sucking all the protein. So because of that, the child may be going for malnutrition. Then the child may have a severe diarrhea. So due to severe diarrhea, it may cause dehydration. Sometimes it may cause shock-related complications. Then the child may go for a loss of appetite. So this is the main complication. Another impacts may be it will affect the school performance and school attendance of the child. Because of worm infestation, it is totally affecting the general condition and general health of the child. Due to that, the child may be lacking the school attendance, and due to that, there may be a reduced physical and cognitive development. So when the child's physical and cognitive development is reducing, it may be reducing the economic productivity of our country, because our economic productivity is commonly relying upon the younger generation's growth. So when the younger generation growth is hindered by these type of worm infestation, it will automatically reduce the economic productivity of the country. And last one is it may lead to severe malnutrition. Severe malnutrition is also an economical burden for our country. When malnutrition is for younger people is reported more, the government has to spend more money on the improvement of nutritional status of the children. So due to that, it may be causing economical burden to the country. So these are all the way the worm infestation is affecting the children growth and country's growth. So along with the deworming, we can practice certain home remedies for deworming our children. So when we are deworming and the next deworming will be after 6 months. So in between these period, if child is complaining of any type of or the child is showing any type of worm infestation symptom in the house, we can follow certain home remedies. So the first type of home remedy which can utilize during a deworming procedure is ajwain seeds. Okay, so that this ajwain seeds will be commonly reducing the growth of the worms during a worm infestation. This ajwain have to be mixed with the jaggery and it should be administered to children every day 2 times until the symptom is subsided. Okay, that is the first home remedy which we can utilize in the home in between the deworming procedure. The second type of home remedy is papaya. The raw papaya is considered to be more effective in deworming the children. So how to make this raw papaya juice means we have to grind papaya, raw papaya, and take a 1 teaspoon of Just juice, add with the 1 teaspoon of honey, and it should be added with the 1 glass of warm water. So we can, when we are giving this to a child during a worm infestation, it may reduce the symptom. Another thing is raw garlic. So you, as you know, raw garlic having the many of the benefits. It also reduce the worm infestation. So raw garlic can be given to a child, or otherwise we can include more amount of garlic in preparing food. This also will be helpful in reducing the worm infestation. Next one, turmeric powder. As you know, turmeric powder having the antiseptic property, we can use more turmeric powder during the preparation of items. During cooking, we can add more amount of turmeric. Next one, bitter gourd. Bitter gourd juice is also considered to be effective in deworming children. So it can be utilized for older children because it having more amount of bitterness. It can be added with jaggery with warm water and it can be given to a child. So these are all the common home remedies which we can utilize for the children for deworming. But along with the deworming tablets only, it is effective. We should not rely only on this procedure. It is only a supportive measure, but we need to deworm the child every 6 months in order to totally prevent the child from worm infestation. So I am concluding my topic by showing a video. yeah.
Hello? Hello? Aspin sir, am I audible, sir?
Yes, yes, sir.
Okay.
Yes, sir.
Sorry for the inconvenience. There was a network issue. Madam have completed her speech regarding the prevention of worm infestation, treatment regimen, and practices which can prevent the incidence of worm infection. So, if you have any doubts regarding these topics, you can ask your doubts in the chat head. So, we will discuss. So, we all know albendazole and mebendazole. These tablets we can give for deworming, and apart from the tablets, we can promote certain practices which will reduce the incidence of worm infection in the children, not only children, in all the people. So we all know when we have little fever, little headache, we use paracetamol, and little throat pain, we use antibiotics. Unnecessarily, also we use these kind of medicines nowadays. But we never, we usually we ignore the use of albendazole and mebendazole. Uh, I don't think all the people are taking this medicine every year, or they are giving this medicine here. They are taking their children to the school for receiving this medicine. This medicine is very important uh, for all the children to get wellness, because it prevent the infections among children, anemia, then their physical and mental well-being. All these kind of aspects will be fulfilled by taking this medicine every year. So based on the place where you are, you have to take it once or twice. I told you again. I am saying Madhya Pradesh and Rajasthan, based on the prevalence, we are distributing this medication only one time in a year. Other states apart from Madhya Pradesh and Rajasthan, there will be bi-annual distribution of these tablets. So I am requesting you to spread this knowledge, awareness to all the people, and enhance the people and their children to take this albendazole tablet every year, based on the prevalence rate, based on the state, every uh, year or twice in a year, which will help to promote the physical health of the children and mental health of the children. So if you have any doubts, you can ask in chat head, and I am not finding any doubts here. So um, I would like to invite Miss Kanjan Devi, Miss Kanjan Devi, ma'am, Assistant Professor, Medical Surgical Department, to deliver vote of thanks.
Thank you, sir. Thank you for inviting me to give a vote of thanks. Good afternoon to one and all joined here. I, Kanchan Devi, Assistant Professor of Medical Surgical Nursing, SCPM College of Nursing, Gonda. I'm feeling grateful to present a vote of thanks behalf of SCPM Group of Education, Gonda. We thank take this golden respected guest of this program, Dr. O.N. Pandey, sir, Chairman of SCPM Group, Mrs. Alka Pandey, President of SCPM Group, Dr. Ayush Pandey, sir, Managing Director of SCPM Group, Dr. Ayushi Pandey, ma'am, Secretary of SCPM Group. I thank you all for joining us on today's program. Further, a big thank to our special guest. Yes. Sorry, I want to pause my vote of thanks. मैं अभी अपने गेस्ट स्पीच के लिए मिसेस अलका पांडे मैम हमारी प्रेसिडेंट मैम को बुलाना चाहती हूँ. मैम प्लीज आइए कुछ शब्द हमारे साथ इस प्रोग्राम पर शेयर कीजिए.
यस सॉरी मैं आप लोग से कनेक्ट नहीं हो पाई है, तो बहुत देर से मैं ट्राई कर रही थी कि आपसे कनेक्ट होने के लिए. आज आपका टॉपिक बहुत अच्छा था, बट टाइम कम होने की वजह से मैं आपसे कनेक्ट नहीं हो पाई. अभी मैं बाहर ही हूँ, तो ऑन एंड ऑफ ऐसे ही हो रहा है. बट आपका सेशन बहुत अच्छा रहा. मैंने अभी थोड़ा थोड़ा हो रहा था, सुन रही थी मैं. और आप सबको बहुत बहुत धन्यवाद कि इतने अच्छे टॉपिक को लेके आपने जो है चीजें बच्चों को, स्टूडेंट को एंड वेल एंड हेल्थ के बारे में सारी चीजें बताई. और इसके लिए मुझे बहुत बहुत धन्यवाद बोलना है आपको. और आप सारे टीचर्स वाकई बहुत अच्छे. थैंक यू सो मच. थैंक यू वेंचर मैम.
थैंक यू मैम. थैंक यू मैम हमारे साथ जुड़ने के लिए और हमें हमेशा अपनी एनर्जी के साथ जोड़े रखने के लिए. थैंक यू सो मच मैम. मैं अब इस सेशन को एंड करते हुए वोट ऑफ थैंक्स देना चाहूंगी. सो we take this golden opportunity to thank the respected chief guest of this program, Dr. O.N. Pandey, sir, Chairman of SCPM Group, Mrs. Alka Pandey, ma'am, President of SCPM Group, Dr. Ayush Pandey, sir, Managing Director of SCPM Group, Dr. Ayushi Pandey, ma'am, Secretary of SCPM Group. I thank you all for joining us on today's program. Further, a big thank to our special guest, Mr. Asaf Dubey, sir, Director of SCPM Group, and Mr. Dheeraj Dubey, sir, Administrator of SCPM Group. Thank you, sir, for encouraging us to organize this program. I may like to express our sincere thanks to Mr. Ramgiri, sir, Principal of St.Xavier School, Ms. Meena Mishra, ma'am, Principal of AIMS International School. Thank you, ma'am and sir, for joining us on this school health education program. I also wish to express my gratitude to Professor Mani Mekalai, ma'am, Principal of SCPM College of Nursing and Paramedical Sciences, and Professor Smita Philip, ma'am, Vice Principal of SCPM College of Nursing, Gonda. Thank you, ma'am, for encouraging us to always encouraging us to organize various programs. We must mention our deep sense of appreciation for our today's speaker on school health education program, Professor Muthu Maheshwari, ma'am, who gave brief knowledge on National Deworming Day. Thank you, ma'am. I would like to express our sincere thanks to Mr. Suvis US, sir, giving excellent coverage on National Deworming Day. Thank you, sir, for giving excellent coverage on Deworming Day. I sincerely thank to all the faculty and supporters to organize this program. Last but not least, I want to thank our beloved participants for making this school health education program as a grand success. Once again, I want to thank one and all present here. Thank you, everyone.